Well, let's go back to our top story now, and concern over Sydney's growing COVID cluster has spread across the Tasman, with New Zealand closing the travel bubble with New South Wales, and Victoria has also tightened its border to the north overnight. We've got full coverage for you this morning. Lara Himes is in Sydney, Wilson Longhurst in Auckland, and Stephanie Ferrier is in Melbourne. Lara, I want to start with you because there's a bit of concern over one of the cases in Sydney that appears to be a mystery case. What are the details?
Good morning, Lisa. Well, concern that a child has actually contracted the virus, and even more concern is that authorities are unclear how the child contracted the virus. The year 3 student goes to this school, the St Charles Catholic Primary School in Waverley. The staff, principal and other members notified parents, students and other teachers yesterday just after 1 o'clock of the confirmed case. They were encouraging parents to come and collect their children in a staggered approach, and as a result they've also moved to online learning for the remainder of the term. Luckily it's only 3 days left of the term, so not too much of a change for the students here and to the curriculum, and they're hoping to resume services as term 3 resumes in a couple of weeks. Authorities are still scrambling though to try to identify the source of this. We know that there have been 10 cases in yesterday's figure. Obviously the child makes up one of them. One of the reassuring parts of that is that most of those cases, though, were already confirmed cases and were already in isolation. So perhaps one shred of saving grace for authorities. But Dr. Kerry Chand says that officials are working to find out where the source is and how it can affect Sydney-siders.
We want to find out how this child was exposed and establish that, because cases where we don't understand the acquisition mean that we've missed cases. And in this case, we don't have, on preliminary information, a source for this child's exposure. So we are looking for an intermediate source.
As part of the government plan as well, mask wearing is going to be extended just over for another week. It is going to include Sydney areas and also the surrounding local government authorities. We do know that the exposure site list is continuing to grow. There are now scores of venues included in that list. And in addition, we did find out more information yesterday that residents who have gone to the ANZ branch in Martin Place, the Chanel store in Westfield, Totti's in Bondi, and also the Wallabies Cafe in Mascot. So that is being added to the exposure list. The advice, of course, is go and get tested if you have visited any of those sites.
Absolutely wise advice. I want to bring in Wilson, who's in Auckland. Well, the Trans-Tasman bubble shut pretty quickly, didn't it? And we've got an issue with a traveller.
That's right, Lisa. The New South Wales-New Zealand travel bubble was slammed shut at midnight last night, but it turns out that was too late to stop COVID-19 coming into the country. This infected person flew from Sydney to Wellington early on Saturday morning on Qantas flight 163 and then returned to Sydney from Wellington on an Air New Zealand service on Monday. And this is the first time an Australian traveller has brought COVID-19 across the ditch under the current travel bubble arrangement. Now, a huge contact tracing effort is underway. Anyone who was on that Sydney to Wellington service who is still in New Zealand is being advised to stay where they are and get a COVID-19 test. At this stage, 4 close contacts of this person, people they were spending time with while they were in Wellington, are isolating and are advised to get a test. But that list of close contacts is now expected to balloon out because the Ministry of Health, just in the past 15 minutes or so, has put out the first locations of interest in terms of places where this person visited over the 3 days they were in Wellington from Saturday to Monday. This includes a museum, a hotel, a bar as well, where they stayed late into the night, so that possible exposure sites are expected to grow as well as the close contacts. But this person is now back in Sydney. They flew back on Monday night where they're undergoing genome sequencing, and New Zealand authorities are watching that closely because we want to find out, of course, if it's the Delta variant.
And look, Steph, in Melbourne there were some late night decisions as well that will certainly disrupt people waking up this morning if they were planning on travelling.
Good morning, Lisa. Yes, not such a nice morning if you're planning on heading to some of these Sydney areas, because if you come back to Victoria, you're going to have to quarantine for 14 days. As you say, health officials made that declaration late last night. As of 1 o'clock this morning, they have declared 7 Sydney zones, 7 LGAs in the Sydney's east as red zones, and that means that nobody is allowed from those areas unless you're a returning resident or you have an exemption. You're going to need that permit and also do that 14 days in home isolation. They've also announced the city of Wollongong has been declared as an orange zone. That means that anybody that comes in from that area is going to have to isolate until they return a negative test. And of course, we had our own outbreak just a month ago and have managed to chase that all down. And so we're expecting to see today the government announce even more easing of restrictions. So health officials here certainly do not want to see any imports of this virus into Melbourne or Victoria from those Sydney areas.
OK, Lara, Wilson and Steph, thanks for all those details.
Meanwhile, Queensland authorities are continuing investigations into how a woman who arrived from Portugal to Brisbane caught COVID in hotel quarantine. Authorities say that a fully vaccinated quarantine staff member could potentially be the missing link. The person escorted an infected patient to an ambulance and later swabbed the flight attendant. Yesterday, a man in his 60s who attended a venue at the same time the woman was infectious also tested positive.
Meantime, Queensland Health is planning to call in private debt collectors within weeks to pursue millions of dollars in unpaid hotel quarantine bills. Since July last year, nearly 30,000 hotel quarantine invoices have been issued in the state, totalling more than $87 million. Earlier this month, only 44% had been fully or partly paid, with 10% significantly overdue.